Hello, dear parents. Topic for today is how do I increase breast milk production? Dear parents, please try to understand. Most of the mothers feel that they do not produce enough milk. But in fact, when we evaluate, most children are doing well and gaining good weight. So, through this video, we'll try to do some myth busting and also understand if really if there is decreased milk production, what are the signs, how do we identify them in the babies, and few solutions and tips for the mothers. When we see around us, we see that most animals who have multiple kids are feeding well with their mothers. Similarly, through our experience, what we have noted is mothers who have had twins or even triplets, that is, three kids, have been feeding well their babies. So, most of the time, the mothers need good support and understanding and education regarding this aspect to feel comfortable in feeding their children. Through our experience, what we have noted is that most of the time, rather than the mother producing less milk, it is the baby who is not sucking or he is not sucking effectively. So, first thing what we need to do is we need to understand what are the signs in the child which will give an indication to understand that he is not getting enough milk. Please understand, it is not about you not producing enough milk, but the child not getting enough milk. So, if your child is very irritable or he is passing stools very infrequently, or if he is passing stools but they are very hard and greenish, if he feeds for a very long time at your breast, or he is refusing feed, or he is feeding infrequently, or he is producing less urine. So all these could be signs that the baby is not getting enough milk. Also, if you are expressing your milk and the milk is not coming out, could also be another sign for the same thing. Now, having understood this, if any of these are there, cannot alone tell that the baby is having a issue of not getting enough milk. Because say for example, if the child is having a colic, he could be excessively crying and he might refuse feeds. These are few subtle signs, but when taken all together, say the child is feeding for a long duration, he is passing a very hard stool, not passing adequate urine, not gaining good weight, if more signs are there, then it could mean that the baby is really not getting enough milk. After having ruled out that the baby is not getting enough milk, we will focus on some of the reasons where there is actually less milk production. So, it could be divided into four factors. Say, 1. The physical health of the mother, the mental health of the mother, the health of the baby, and factors associated with your breast. So, these four broad groups can be faulty when there is decreased milk production. Of these, the most common factor is the mental health of the mother. Invariably, if the mother is stressed or she is worrying a lot, she is very anxious, all these are common reasons for the mother to have decreased milk production. So also, because the mother is tired, that is she is feeding the child, taking care of the homework and running around with the other child, sometimes tiredness also produces less milk. So also sometimes the mothers worry about their physical form, which can also cause decreased milk production. Now coming to the second factor, that is breastfeeding factors. So sometimes if there is delayed initiation, or sometimes mother feed the baby at fixed time, infrequent feeds, lack of night feeding, that is they don't feed at night, if early introduction of pacifiers or bottle feeding is done, these all could be some of the factors which can lead to hindrance of good breast milk production. The health of the mother physical and the health of the child are some of the factors which can also play a role, but these are very very rare. So if we give good attention to the mother's mental health and take care of the right methods of breastfeeding, then you'll definitely sail through the process. Now, having keenly understood the problems, coming to the three most important steps in tackling this. First step would be to confirm that the baby is gaining good weight and passing good urine. If so, first thing to be told to the mother is, do not worry, everything is alright, he is getting enough milk. This is the most common thing. Now, coming to the second step, that is address the problems of the mother. That is, if she is tired, give her adequate rest. If she is worried or anxious, reassure her. If she is having a difficulty, then give her help. So this is the second most important thing. The third thing would be regarding the breast factors. That is, if the mother is educated well before delivering, then she'll be a lot more confident, and whatever the factors associated with attachment and positioning should be properly explained to the mother, and the right methods of exclusive feeding should be explained to her beforehand. If we have done these three things, invariably most mothers are successful in breastfeeding. Finally, coming down to some tips which will help these new mothers. First thing is rest, rest, and rest. Adequate rest in the mother will definitely help her to increase her milk production. Second important point would be hydration. We have to advise the mothers to drink adequate amount of water. So many times culture bound practices avoid mothers from drinking water, but this is a big deterrent. Drinking good amount of water always is associated with good milk production. So many mothers can actually feel this when they drink good amount of water or electrolytes. Immediately the next feed they'll have more milk production. The third most important part would be dietary practices. A lot of time again culture bound dietary practices hinder milk production. Some of the foods which are good for milk production are green leafy vegetables. Increase in intake of these helps milk production. Oatmeal, you can advise mothers to have a oatmeal for breakfast, or oatmeal cookies are good option. Some of the options like fennel seeds, fenugreek seeds, and cumin seeds have been known to increase breast milk production. Garlic in moderation also helps in increasing milk production. So see, these are some of the foods which increase breast milk production. Also, another factor is adequate breast emptying. This is the key. Understand that if baby sucks well and the breast is completely empty, this is the strongest stimulus for producing breast milk. So all mothers must focus on emptying one breast before going to feed on the other side. If the baby sleeps beforehand, then manual expression or breast pumps can be used to empty the milk, so that this increases breast milk production more. Avoiding restrictive clothing or tight clothing in mothers has been known to promote good milk production in mothers. Rooming in or bedding in, that is physical stimulus of the child frequently with the mother, kangaroo mother care, that is the baby lying on the chest of the mother, allowing the baby to be in the same bed or with the crib in the same room, have all known to produce more stimulus, that is hearing the cry of the mother baby, touching the baby, seeing the baby, helps the mothers to increase the milk production. Also, some of the medications which can be prescribed by us, for example lactare or promolact or some increasing granules which are available, can also help in few rare scenarios. So dear mothers, please understand that invariably you are producing good amount of milk, and if at all there is any problem, there is help. So if there is any questions or queries, please leave a note in the comment section. Thank you.